So today we have Mike Camporini, a physiotherapist and a partner in the Helix Human Performance. And he's going to share his ideas about the way to heal of chronic pain and issues in the musculoskeletal issues. So thank you for joining us, Mike, and let's just delve in. I saw in your page many photos of before and after, people who
Sure.
were totally crooked, and one side is higher, one side is lower, and it was really impressive to see the change.
Thank you.
Can you tell us what is the way you are working with people who come with issues of misalignment or pain?
Sure. So I think it's useful to kind of lay the groundwork a little bit more. So yourself and then some of the listeners can have a little bit better of an idea of where I'm coming from with some of these things.
Sure.
And to always kind of have in mind that, you know, Instagram, especially lately, is a very useful tool when it comes to business and when it comes to spreading information. But I see it as almost like a thumbnail or a very, 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 very small window into how the entire situation can be presented, because there's only so much that can be presented in a few slides of photos or a 30-minute or a 30-second video, or a 4-paragraph blurb. People tend to have a shorter attention span, and that's not a knock against them. That's just the format and the platform, right?
That's right.
So you need to be a little bit short, concise, and limited in terms of how much you're actually presenting on there, because it's certainly not the entire story. So you might see a before and after, and it shows a change in posture, and that's readily apparent, and people can see that within 0.2 seconds, and it's great for demonstrating that on Instagram. But that's not going to be the entire story for their situation. If we were able to even record an entire session with someone, that probably still wouldn't even encapsulate the entire issue that they might be having. It would be much, much better than just what you see on Instagram, but certainly still not the entire story. So a lot of times, anytime I talk to people and I get a feeling that they're starting to get overwhelmed and they have a lot of questions and concerns about how many things are a factor in their situation, because they're right. It can be extremely overwhelming, and there's, in any kind of complicated situation, there's always going to be many different facets that are influencing their predicament, especially when it comes to chronic pain, right? So the way I then try to present it to them is I'll take a piece of paper and I'll draw out a pie chart, and I might draw, like, I don't know, 6 pieces on that pie, even though it could be 80 pieces on that pie. And each piece kind of represents a certain factor that might be influencing their situation. Okay.
How do you know which facets are typical to that?
Great question. So that's what the assessment's for. And then I'm also limited with my scope of practice. So that also kind of sets the expectations that they need to have when working with me, because there are going to be facets that are part of their predicament that I'm simply not going to be able to help them with just based on my scope of practice. So I'll give an example of a really cut and dry case of someone was playing basketball and they twisted their ankle. Okay. And I draw out the pie chart and then, go through all the facets. One of the facets might be a torn ligament as to why they keep experiencing instability or pain within their ankle. I can help with that situation. I can't solve or completely get rid of that situation. They need to go to see an orthopedic surgeon for that.
Yes, okay? It's a structural issue.
Yes, exactly. And so they need to see someone within their scope of practice. Yes, I can help heal or fix or reconstruct that ligament, right?
That's right.
So then same thing if someone comes to me with IBS or irritable bowel syndrome or some issue with their GI system, I can help in terms of intra-abdominal pressure and the distribution of that pressure within their body. But if there's some sort of GI issue or dietary issue, will it be an influence on their situation? Absolutely.
Yeah.
But I'm not going to pretend like I know what I need to tell them in terms of dietary information to help guide them to a better situation, right? Sure. So my scope of practice as well as their situation tends to help filter out some of the factors that we can start to work on together.
Yes. Because sometimes
that's a big deal.
There is a line that connects. For example, if you were talking about IBS, it could be a breathing issue, which
maybe
beyond that, it could be emotions that are not resolved, anxiety.
Absolutely. And so again, like if that's also part of the situation, and I need to have a conversation with them about like, okay, again, let's lay out all of the facets, because then this also helps them have a little bit of a structure or framework of like, okay, who is it that I actually need to go and talk to? So each piece of the pie chart might have a bigger piece of the entire whole. And so is that bigger piece of an entire whole something that I can help them with? Or maybe someone with IBS realizes that they have a poor diet or poor dietary habits, and that's like 80% of the pie. Okay, I can still help with the other 10 or 20 pieces. Will that help your situation as a whole? Yeah, sure. But is your time better spent with something else in order to capture or manage that bigger piece, so to speak? Yeah, that would probably be much more effective use of your time, and you'd probably start to see results a little bit faster. Okay.
So are there also clean cases of muscles, tendons, so in the scope of your expertise, which you can help? And of course, the alignment can extremely affect.
Sure. So then, and that's where, it kind of makes my job easy, so to speak. It's like, okay, we do have many different facets happening, but they're in my wheelhouse. So I feel like I can actually tackle them much more effectively for this person. And we'll be able to see some pretty decent results for them relatively quickly because of that. So it's much easier to manage that kind of situation than when you need a multidisciplinary approach, because then, okay, problem number one is acknowledging that is part of the issue. Problem number two is finding someone that can also work in conjunction with that, and the two of you aren't interfering with those kinds of situations. So that's where things start to get a little tricky, a little bit more in the gray, a little bit hazier as to, okay, how are we now going to navigate this? Because you're going to need multiple guides or captains, so to speak. So,
but posture is a huge one. Like posture can affect, posture and gait, and all the things that we do consistently and we are oblivious to how we do it. We are unconscious, like vision, how you look, how you breathe, how you walk. We can be so habituated in these activities, and they might affect even biochemical stuff that is going on. If you are an inhaler and you breathe too much and your CO2 levels are down, are not enough, then
absolutely. So and you're kind of
so
hinting at this same idea.
I understand what you said, that you give them clarity and you set the so they would not have high expectations in places that they cannot be provided. But if we take the slice in your scope of helping people with posture, alignment, and it's not just awareness, it's much beyond awareness, right? You give them drills to move towards a better alignment. And like my intuition is that with this you can accomplish a lot.
So and you're kind of hitting on this theme that I wanted to make sure was part of this this call, where it's always going to be something that's multifactorial. So we can take pain, and that's always going to be multifactorial. And then a section of their situation might be what we would call posture. Okay. And so you can take that, and this is where things start to get complex. And I tend to not go into this much detail with my patients because it starts to get overwhelming. It's like, okay, I'll shoulder this burden and I'll try and figure that out for myself. That's part of my job description, right? So we can take that pie section of their painful situation and let's call that pie section posture.
Yeah, I understand.
Right? Take that pie section, and now that's its own pie chart. And now part of my job is trying to, kind of what you were saying, maybe it's a visual situation, maybe it's a breathing situation, maybe it's something with their lower extremity, maybe it's something with their hip, maybe it's something with their rib cage, etc. So there's all these different facets that might be part of what we would call posture. And then now it's part of my process to try and figure out, okay, how can I start to influence some of those things? Quick notes on posture. So posture, people tend to think of posture as like this kind of static alignment. And I think how it's presented is also misleading because, again, on Instagram, we kind of see these screenshots of these before and afters and these still frame pictures. Okay. But when it comes to posture, even if a client brings it up, I tend to not use that word. I don't necessarily know what I call it. I just kind of call it movement, or improving their ability to move, or giving them some different movement options. But because posture is relevant to their vocabulary, I kind of go through that with them. So when it comes to posture, what I essentially say to all of my clients is posture comes down to two things. So it's a solution to two problems. Okay. You got to breathe, otherwise you suffocate, and you got to fight gravity, otherwise you fall on your face. Wow. And posture is the solution to those two problems. So your brain and your body come together, they have a conversation, and they figure out, okay, based on the tools I have at my disposal, so the body I currently have, and then these two problems that I'm presented with, how best can I manage those two problems with the tools I have at my disposal? And then they come together, have that conversation, and then they spit out a solution to that problem, and we call that solution posture. Okay. So when it comes to correcting that, managing that, changing that, part of what we need to do is show your body a new solution to those two problems.
Uh-huh.
And
Nice.
so any activity that I'm going to utilize that focuses on changing that kind of variable needs to have consideration to those two aspects. Okay. So hence why a lot of the exercises I might do will take those things into consideration. Okay. And there's many different ways into how you can do that. Hence why, any exercise or any activity that you might do, whether it's a split squat, a push-up, a 90-90 breathing position,
Mm-hmm.
or going for a hike, or putting something in your shoe, or changing the lenses in your glasses, or I'll use different like taping techniques. There's many different ways that you can influence that, but at the bedrock of that, those are the two problems that we're trying to essentially
This is
solve
beautiful.
for this
Yes.
person.
The way you
So,
analyze it, the fighting gravity or managing gravity and the breath are the two components that do you think that just by awareness to these two factors people can accomplish a better, by the way, there is a word, an alternative word to posture, and it is acture. Moshe Feldenkrais used it. He also didn't like the
yep.
word, so he called it acture because we are constantly
Yeah, we're always fidgeting. Anytime I
fidgeting.
take a breath, there's a ton of movement that happens with a
Right.
breath. That, yeah, you're not static until you're dead, pretty much. So there's always some sort of dynamic action that's happening for you. So Feldenkrais was smart to use a word like that. So
How do you notice that a person is struggling with gravity and like that he has issues? How do
I wouldn't necessarily call it issues on them unless they can't actually fight against gravity.
Yeah,
um
but
I
sometimes they take it to the compensation that they do in order to stay erect.
so I even tend to have an issue with the word compensation,
Why is that?
because it kind well, so it kind of denotes this idea that like, oh, that kind of action is bad.
Right.
Okay. So again, this kind of comes back to your body is simply trying to find a solution to those two problems.
Um,
It found one. That's a good thing. You're not suffocating and you're not falling on your face all the time. Otherwise, you'd have a lot more issues to contend with, right? So your body found a solution.
it's very
When that's
relieving, this reframing of the way that you reframe it and the new narrative that you give it, it's very relieving because you don't
yeah,
you don't feel any more crooked or distorted or guilty.
right. Yes. So you got to take the guilt out of it for some people, because especially if they've been dealing with something for 5 or 10 years or something like that, they tend to start to blame themselves, especially after they've seen, you know, five
Mhm.
or 10 or however many different practitioners or something like that. So
That's right. Mhm.
it's important to reframe that for them, right? Um, what were we talking about before?
Uh,
Lost my train of thought.
we were talking about breath and gravity, that
Oh, right. So,
you address these two
right.
components.
Well, so, and we kind of started talking about compensation and things like that, and how, so again, like I don't tend to use the word compensation. For some people, for less chronic situations, for less of a situation where I feel like they need to reframe it, compensation is fine. I'll We can use that word. They understand it. Your body's doing something that is, advantageous to these two problems, but it's creating a certain consequence because of it, right?
Right.
So we can use the word compensation for that kind of person.
Yeah,
But for someone else, I might still have to say, hey, let's reframe this. Your body is doing the best it can
yeah.
with what it's got, and it's doing pretty good for you. But this kind of strategy is creating a certain consequence that you are now dealing with, and that's why you've come to talk to me. So I'm going to essentially work with you to teach your body a new strategy that won't have the kind of consequence that we are seeing with you right now.
It's very empowering to have more options.
Yes, extremely.
Mhm.
I think that's kind of true in all facets. Like if you're, I don't know, I always come back to the financial. So who is it? Warren Buffett always wants you to like diversify your
Right.
investing portfolio, right? So it just gives you options in case like one
He
thing
says
falls off.
he has a beautiful saying, diversity is the best guarantee against ignorance.
So
Right.
there you go. That's pretty good. Yeah, it definitely there's always going to be unpredictable aspects in life, right? So the more options you do have, the more you can kind of garner against some of that unpredictability. So that's what I try and help people with essentially.
So how is this session looks with you? You first do the assessments or
So again, they come in and chit chat with them. I get their history, see what problem they're kind of dealing with, how I can help them. If we have to go into detail, just based on kind of how they're talking or how they seem like they're framing the situation for themselves, I might delve into, hey, let's do some of this reframing work to start, so that then we can go into this situation with a different kind of appreciation for how this is going to go, right?
this is beautiful.
Then yeah. So then I go through my movement assessment, which, and again, that might look different for some people. That might look different based on the format, because I do a lot of online work. So obviously I'm not going to have the same kind of process online as I would in person. And then I always try and find something where it's going to be relevant to them. So let's say they're coming to me for a neck or a shoulder issue. I'll try and have some sort of assessment around that, and then they can use that as a tool to help guide them. And then I'll have my own kind of assortment of assessments to help myself in terms of understanding, okay, well, what strategy is this person using to breathe and to manage gravity, or to do all the other things they do.
But usually the issues in this realm of the muscles or the skeleton are systemic. It's not only the neck, it's everything, including the fascia,
Correct.
has changed and diverted. And again, it's beautiful to reframe it as the body is doing something good for you, to keep you erect and breathe. But
For sure.
But still,
So
if someone has a local issue, do you look at the whole body? The assessments are not.
Absolutely. Absolutely. Yeah. My process deals with the entire system, but because their personal issue is most relevant to them, I give them some sort of tool to demonstrate that there is change occurring within that localized area of the body. But I always try and circle back to, hey, we are doing this more global exercise, or this exercise that's focused more on this part of your body because of X, Y, and Z. And that's how we bring it back to the neck. So I might have someone do something for their hip, or for their rib, or for their wrist, or for their shoulder, that will then influence their neck. And it's my job to now connect the dots for them, so that, again, it takes that complexity out of it. So they're not floating there just saying, oh, well, Mike said if I do this for my wrist, it's going to help my neck and I'll just take them on blind faith. Like they need to have an understanding as to why some of this is relevant for them. It might not be as rich as my understanding, but it at least gives them something a little bit more concrete. So that
Yes.
gives them a better reasoning as to why they should be compliant with this kind of thing and that nature.
So if you see that the problem, and usually it is systemic, that maybe they have an issue in the neck, but the whole axial skeleton turned to the right, and it creates the. How do you know where to start from? I mean, I'm talking now about how do you pinpoint the place, the exercise to start with, the drill to start with, and
Sure.
there is
So
no magic bullet or that you can
no,
push, but how do you
so I'll say
sequence?
this.
Mhm.
It depends on the person, depends on the presentation. And then I'm going to come back to this like multifactorial principle again. So I'm going to do an assessment, and it's showing me that I have my pie chart, and I have essentially regions of the body that I start to care about, right? And what kind of presentation is at each region? How drastic of a presentation is it at each region? Will kind of hint to me, okay, that is a bigger piece of the pie chart. That's that much of the pie chart. That's that much of the pie chart. That's that much of the pie chart. And then that helps me start to formulate a little bit more of a strategy as to, okay, this is going to be a more influential exercise for them. This is going to be a more influential exercise for them. This is better for them, kind of thing. That goes into individual structure as well. So how much is their own individual structure influencing this kind of situation? Because there might be a similar presentation at a bodily region between two different people, but those two different people have very different overall individual structures. How does that influence my exercise selection? Because they might have the same kind of turn or rotation at a particular body part, but how they might manage gravity or generate pressure would really dictate how I might choose an exercise to influence that presentation for them.
So this kind of knowledge that you have is more subtle. It's not, it's
Yes,
more,
and I am working on it every day, and I am wrong plenty of times, and that is the fun part of continuing to work on it and get better and better and better and reflect and figure it out what I'm doing wrong for that person and etc.
so
That's the complicated part for us.
But this is the heart of the issue, to
Yeah.
it's not a knowledge that you can copy, paste. It's more
No,
it's more hidden, and you need more
it is
intuition and experience and lots of.
exactly. It is as a younger therapist, it became apparent very, very quickly that this is an experiential type of knowledge. It's not something that you're going to read in a book. So I'll give this kind of anecdote, I guess you could say. Like the first couple months I was working. So let's say, like, let's take my experience with Bill for a second. The first month you're there, you don't know what's happening, what's going on, right? You're just kind of, I wouldn't say doing what he's telling you, but doing what he's kind of nudging you towards doing, kind of thing. You don't really have an understanding for why, as to what you're really doing that. And then you finally have one or two moments where you get a reminder in your head of like, oh, okay, this is this situation, or now I can finally like acknowledge that this is happening. you start to recognize certain things. It's kind of like if you're driving in a new area, you're heavily reliant on your GPS on your phone or in your car, right? But then the longer you spend in that area, the less reliant on that GPS you start to become. And you might not necessarily even be relying on the road maps or anything like that. You just recognize a building or a garbage can or a street sign or something like that. And then that helps you to orient to your whole surroundings, right? So unless you're a savant or something like that, and you get dropped into a place and you just need to look around for 2 seconds and you have an instant idea of where you're at, most people are going to have to spend time in that new area in order to kind of map it, orient themselves, figure out where they are, that kind of thing. And it's the same thing for any kind of skilled practice, right? So
yeah, it can be, of course, I understand what you are saying. There is a moment in as you develop as a therapist or any mastery, that you acknowledge that you drop the technique, you drop the ideas, you just it is called tacit knowledge. It's a knowledge which you cannot copy or learn from a book.
right, it becomes embodied.
Exactly. This
So
is
there's it's not that you're not conscious of it, but it's essentially like you're bombarded with like 7 different perceptions at once. But because you've embodied those perceptions, you can now acknowledge that, right? So I can what would be a good example of this?
It's like a direct knowledge that you have. It's something that you just, as you say, embody it, you sense it, that this is the way
Right.
to go. And
right. So we're talking about multifactorial things, and there's multifactorial perceptions that need to happen all at once. Your conscious mind is not able to actually perceive that many things at one time. You might think you do, but you do not. That is not how things work. So you need more of that embodied knowledge to be able to capture even more information at once, as opposed to that more conscious book learning, written on a test kind of knowledge that some people have.
it's what you say is it's not linear. It's more circular, more complex, more sophisticated.
For sure.
And of course, thinking can also, the rational thinking, it's an asset. We can't dismiss it, but sometimes it conflicts with the wisdom of the body, which
it's that aspect that I've found personally is much more useful for reflection. So I had success with someone. Why did I have success with that person? My rational mind can then better be able to reflect on, okay, it was this perception and that perception and that perception and that perception and that perception. Let's put it all together in a more cohesive story for myself, as well as for the patient in front of me, right? So that's where your rational mind or your conscious mind becomes very useful, as kind of this metacognitive aspect to how am I going to continue to get better at what I'm doing, right?
So to summarize this, if you had to choose a therapist for let's say postural, I'm using this word just for the communication, for postural and for misalignment, and you would like someone to help you feel more balanced and more to feel more yummy under your skin, more to feel the deliciousness of because everything is in more or less in its place, and not deviate from the midline. How would you? What is your suggestion? How to choose a therapist who encapsulate all the goodies that you were talking about?
I wouldn't necessarily um, say that I am purposely trying to look for someone who's good with posture, good with alignment, or anything like that.
Mm-hmm.
What you need to find is someone who acknowledges the multifactorial aspect of this,
Mm-hmm.
and then also has an approach that can identify that and help guide you with that.
Mm-hmm.
Because there's going to be holes within my this is something that I think I'm very grateful to Bill for, is because he's been able to at least develop something that tries to encapsulate as many things that he has been aware of in the past umpteenth years of his experience, right? So I can now take that and start to build upon it and say, okay, what else is not encapsulated within that? And that's what someone needs to find is, do you have a practitioner that acknowledges that there is a myriad of things that are always going to influence your situation? Do they have um, a methodology in place that helps to identify those things and then also address those things as well?
Mm.
Those are the main things. So it might not even be a posture thing. It might be a structural thing. It might be a a nutrition thing, a something like that.
Yeah.
If you go to someone that doesn't have a methodology in place that helps them to acknowledge something like that might be going on, it starts to become a waste of, maybe not a waste of time, but not the most lucrative usage of your time.
Mm.
So
Yeah.
that's the advice that I would try and give someone.
This is humble humility. I think a good therapist should recognize
For sure.
genuine mm, like knowing that he has lacunes, like as you said, holes in his way of working. And so if you have
Yeah,
to give,
there always will.
this is a very simple question, and let's wrap with it. If there is someone who has chronic pain and he reached, as you said, 10 years of, he tried every modality on earth, and what what advice would you give him if he finds himself in despair?
Uh, Keep going. Because
Mm.
I mean, what choice do you have? You know, you're always going to have some sort of issue or some sort of problem, and that's relative to other people. It might be bigger or smaller.
Mm.
Relative to previously in your life, it might be bigger or smaller. But they're always that's the harsh reality of being a human, is that there's always going to be some sort of big issue that you need to address. There's no one in this world that doesn't have something like that they need to pursue against and work on and continue to find a solution for, right? So that is, my issue is, how can I continue to become a better practitioner? Am I
Mhm.
going to stop? There's plenty of times that I'm extremely frustrated with myself and I don't want to keep doing this. Does that mean I just quit being a physical therapist and I go and do something else? Because, well, if I go and do something else, that just gives me a new problem, right?
Mm.
So having a mindset where you at least need to acknowledge that there's always going to be these issues, there's always going to be certain things that you need to work against, and then understanding that you are the kind of person that has the capacity to find the solution for it. I think that's going to be more effective than um, allowing yourself to succumb to the problem. Do we all have those moments where we gotta, feel sorry for ourselves and let pity take its course and almost take a break from this constant striving? Yeah, sure, we need a break, but we gotta get back into it. Otherwise, it leads to even worse problems as opposed to improving the situation.
So you mentioned that there are times you are frustrated. Are there cases, can you categorize, let's say, patients or clients that you know at the beginning that this treatment is more inclined to failing? I'll reframe the question. When does the treatment doesn't work, depending on the person, or is it just an issue of a case by case?
Always case by case, but I think people get most frustrated depending on the amount of time it takes to solve a problem. Okay. And so if I come into a situation and I acknowledge that, oh, okay, I have an idea of what the solution needs to be, but this is going to be a time intensive process. I try and at least I acknowledge that as best I can, and then try and set the expectation for them that that is the reality of the situation. Because again, as long as they have that expectation and they can accept that, then it makes it a hell of a lot easier for them to go through the process, as opposed to expecting this, like, I need this done now. I can't live with this any longer. This needs to stop immediately. Like that isn't as useful.
Yeah.
So,
but relatively, I think you in this model you achieve very quick results.
for some people, yes. So when it comes to movement, and we kind of talk about it, really at the end of the day, what I'm trying to do with someone is redistribute pressure throughout their body.
Yes.
For some people, that's a lot easier to achieve for many different multifactorial reasons, and for other people, that's not as easy to achieve.
Yeah.
The sooner I can acknowledge that and recognize that, and then relay that to the individual, the more realistic of an expectation we can have for the circumstance.
So people with rigidity in the mind, like if the brain is so fixed, there is a fixation on how you distribute the compression and the pressure, it would be tougher. If the brain, for some reason, the nervous system, if for some reason it clings to a specific presentation, how do you persuade the mind, the brain, to accept, to agree, to allow other options?
This is the tricky part of creating trust, and so as any practitioner listening to this can kind of agree that it is way easier to work with and create changes with someone that has trust in what you're doing for them, right? Because what essentially you've now done for them is essentially take some of that rigidity in their thought process away, and whether via your presentation of the situation or their own personality enables them to be more like that, it enables them to create changes as well. So they don't have the same kind of overarching perception that they once had. We can start to mold that a little bit more into something that is more conducive. So again, like if they trust that that is what you're able to do for them, they can do away with this prior perception and now start to adopt a new one that I don't necessarily give to them, but we start to kind of craft and mold for themselves. So I think it's a cool part of the job, and I think that is at the heart of why people always talk about building trust and getting buy-in. Someone's really bought into a situation. It makes it a lot easier to work with them. So
I love the word trust that you brought here, because it's not only the trust in the practitioner, it's the ability of themselves to trust that in themselves, in the other option that they present to the body, that it will not.
sure.
Thank you so much.
Absolutely.
That
Yeah,
was,
this was fun.
was fun.
Good
Thank you.
little mental exercise for me in the morning, so I appreciate it.
Yeah, I loved this conversation and studied a lot from it. Thank you so much.
Cool. Yeah, it was great meeting you.
Yeah.
Thank you.